right, let's go through this question here.
Which of the following is the most appropriate next step in the management of this patient? Administer activated charcoal, begin hemodialysis, initiate IV fluids, prescribe furosemide, or reduce the dose of lithium. Okay. A 45-year-old woman with a history of bipolar disorder presents to the emergency department with complaints of tremors, ataxia, and confusion. Her vital signs are stable. Her lab reports serum lithium of concentration of 2.5. I don't know if that's high. I would use that
Okay,
laboratory values to tell me if it's high or not.
sure.
Um, I think so we have complaints of tremors, ataxia, and confusion. If you have an overdose of lithium toxicity, this is kind of where my mind is thinking right now, is if you have an overdose of lithium toxicity, I feel like you have like issues of like more like thyroidism, like hypothyroidism. I don't know why I'm
Okay.
going with that. I feel like that's like an issue with lithium toxicity. It's like you gain weight. I don't know if it's necessarily this,
Okay.
but in the same idea, the only thing here that they're giving in the question is that like you have actually is 2.5 high?
It's hard to say, but my question is, when you could string this clinical scenario together, right? You have to ask yourself, what are they trying to ask you? You get what I'm saying? So in my mind,
Yeah.
right? I mean, this is how I work through it. This is me in your position. I'd be like, hey, 45-year-old female. She already has a diagnosis of bipolar, and then now she has tremor, ataxia, confusion. So she has some sort of emergent issue. It's acute. Her vitals are stable, but her labs reveal a lithium concentration of 2.5. Okay, so then I mean, I'm just telling you how I think through things, right? Why are they giving me a lithium concentration if it's normal low? That makes no sense, right? So it has to be
Yeah.
high in my mind, right? So she has, in my mind, she has a toxicity of lithium. Okay. So then in my mind, I'm thinking, okay, so what are some side effects of lithium? So give me some side effects that you can have from taking
Again,
lithium.
I could be completely wrong. Is it not just like those like weight gain and like hypothyroidism? Is
I
it
don't
not?
remember if hypothyroidism, you can correct me if I'm wrong, but when I'm thinking about this problem, I'm thinking like, I'm pretty sure it can give you what, SIDH or something like that, if I'm not mistaken. I'm not sure. I can't remember exactly. I
You
remember
could be
it's like,
right. I don't.
yeah, lithium either gives you, or diabetes insipidus or SIDH. I can't give you
I
remember
think you're
exactly.
right with the diabetes insipidus.
So it could be diabetes insipidus, but it deals with sodium. I just know that.
You're
So
right.
sodium.
We're both right actually. So it is hypothyroidism,
Oh, okay.
Epstein anomaly, nephrogenic diabetes insipidus,
Diabetes insipidus.
and
That's
then
what it is.
tremor.
Yeah. So you're thinking, okay, so what can give you tremor, ataxia, confusion, right? That's probably like very bad DI, right? Diabetes insipidus, right? And so SIDH is the opposite, which is too much ADH, which you're hyponatremic. So DI is when you're what? Hypernatremic, right? And so then your question is, okay, what do you want to do for that? You see how I work through that?
Hmm.
So now you're
So did you
hypernatremic.
call this an emergence? Like as in this is an emergency?
Yeah, she's at the emergency department, right?
Okay, okay. With tremor, ataxia, and confusion. Um, well, to me, if you reduce the dose of lithium, that's not gonna. I mean, I feel like that's like a bait answer, and this could be again like I'm missing the point entirely. But
Sure.
like, I feel like it's a bait answer because it's not gonna immediately solve the issue of it. This is an
Sure.
emergent issue. Needs to be solved with something like to counteract it. And
Sure.
so I would say you need to give. I actually don't. I don't. It's not hemodialysis.
Okay.
Furosemide. I mean, that's just a diuretic, potassium sparing diuretic. I don't know what that would do here. I mean, unless that's just like, oh yeah, that's honestly, I'd probably say administer activated charcoal because I feel like that's like some type of like antitoxin. Like, I don't know. I actually don't know.
So let's talk about this. So answer would be IV fluids, right? Because I'm trying to get you to think of like, I know this sounds weird, but you want to put yourself in the test maker's mind, right? So like I said, they're testing over, do you understand that overdose of lithium gives you diabetes insipidus? So if you understand that, then the next step, I mean, this is a third order question, if anything, right? So you have to know it's a lithium overdose. You have to know that too much lithium gives you diabetes insipidus, and you have to know what diabetes insipidus causes serum wise. So that causes you a hypernatremic state, hypernatremic.
Hmm.
Okay. If you're hypernatremic, that means your sodium concentration is off the roof, right? So, how do you lower a sodium concentration? You give them
You
more
give more
fluids.
fluids to counteract to like
Yep. To dilute it, right?
dilute it. Yes.
Right. So, activated charcoal, I mean, it's not, that's, if you think about activated charcoal, that's more for like the stomach, right? Begin hemodialysis, right? I mean, Yes, no, maybe, but something, faster that you can do is just push fluids, right? Hemodialysis is never a bad thing because you're just filtering the blood to create it what's right, but this is going to be faster and less invasive. And then prescribing furosemide, right, which is a diuretic, that's if you had SIADH. You get what I'm saying? So if these two answers are complete opposite, then probably one of them is the answer. You get what I'm saying?
Yeah.
And like you're saying, reduce dose of lithium. Yeah, of course, you're going to want to reduce it after, but you got to treat the acute thing. You know what I mean? So, and by the way, this is a step 2 question, by the way. So you don't have to feel bad about
Still, I
missing.
I, I could have got that right, and you're right. I think the big thing I had to memorize there is, yeah, I mean, I had just the one symptom of like it is cause hypothyroidism, but it does also cause the tremor. And so, yeah, again, they give us a value of lithium that tells me like, okay, there's definitely a toxicity of here of lithium. What does lithium cause? Lithium can cause like those symptoms, like we already see tremor,
Yep.
hypothyroidism, which I guess is really not relevant here, but you're right, diabetes insipidus, and then what does that cause? That causes necessarily like a hypernatremic state, which you would need to counteract with IV fluids.
Perfect.